Hello everyone, this is Dr. Shoaib here. Today we have with us Dr. Hadi Chishti, who is going to speak about MRCP. We are lucky to have him here because he passed his paces with 100% score. That is a rare gain, and I think it will be a really beneficial session, especially for those people who are interested in medicine or who are doing training anywhere. In the world in medicine, and they want to pursue their career and enhance their skills. This exam is for you. Let's talk about MRCP. Thank you so much, Dr. Chishti, first of all.
Thank you very much, Shoaib. I am basically from Pakistan and I have graduated from Rashid Latif Medical College, which is a private medical college in Lahore. After my graduation, I came to UK. I worked in Pakistan for a little while. I worked in an RSC. After that, I came to UK in around 2018 and initially worked in A&E for a little bit. And then I started my internal medicine training. During my internal medicine training, I started my MRCP as well. I did PLAB to come to UK and then MRCP to progress in my career. So at the moment, I'm working in Belfast as a specialty doctor in cardiology and general medicine and hoping to apply for training, inshallah.
For training, okay. That's really good. Right. So, my first question is what exactly is MRCP?
So, brother, MRCP, it's a membership exam which you take during your internal medicine training, like not in your foundation training, but in your internal medicine training. You can take like first two parts or maybe all of it during your foundation as well, but it's basically part of your internal medicine training. And in UK, you take it to progress to the specialty training, like higher specialty training after your IMT. You cannot start high specialty training without having an MRCP. Basically, a registrar role is what you need. You can say. But in other countries, it has different values. For example, in some parts of Pakistan, you can be considered as a consultant as well if you have MRCP. In some parts, they find it equivalent to FCPS, although as per CPSP is not equivalent to FCPS. So CPS SP says that like if you have MRCP, you will be exempt from the first 2 years of the training, and I think IMM as well. You're exempt from part one and IMM, and then you start from there. So something like that, their rule is. So, but I have seen a lot of people who work as a consultant after doing MRCP in Pakistan.
That's true.
If you come to the Middle East, yeah. So if you come to the Middle East, if you have done the MRCP, you will be taken as a specialist.
Okay.
Your consultant job depends on your training and year of experience, but will be mostly considered as a specialist, not a consultant. Consultant usually they take full FCPS or full CCT from UK. In UK, there is another thing that I've noticed in a lot of hospitals. Actually, many MRCP doctors actually work as consultants as well, without having a CCT, especially in general medicine. That is because sometimes mostly they are locums. Sometimes what they do is after MRCP, they do the Caesar pathway and get their all consultant things signed off. Or sometimes what they do is like they just become a locum consultant after a few years of experience if the hospital allows. And I've seen actually that a lot of people have been working like that. You might have noticed this as well.
Yeah, that's true. Especially in rural areas and in suburban areas. Yes, in our hospital we have, I think, at least 4 or 5 consultants who have just done MRCP and they haven't done even the Caesar pathway, and they are working as a locum consultant. Yeah,
exactly. Yeah.
right.
So
Okay.
yeah, that's
so and also if you want to go to other developed countries, MRCP is also formally recognized or partly recognized. For example, if you go to Canada, MRCP does have weightage. I mean, it's not formally recognized, but it still has weightage. Same goes for Australia
exactly.
as well.
And same goes for Ireland as well. I was just recently looking into Ireland's exam, and what I could find was that Ireland also recognized MRCP. So it's basically it's widely recognized exam, and it is I think one of the very prestigious exams that you have anywhere in the world in the medical field, especially in
That's
medicine.
true. Especially if you look at the structure of the exam, there are 3 parts in MRCP. Dr. Chishti, of course, he passed this exam recently, so he will be in a better position to tell about it. But 3 main parts: MRCP 1, MRCP 2, and then PACES. And the structure is really fantastic. I mean, it will make you a better doctor. Even if you are not interested in doing training in UK or moving to UK, Still, if even if you are a doctor in Pakistan and you just want to gain some degree and gain some knowledge, to have a better experience with your patients, I think this exam is one of the best things you can do for medicine, of course. I
Definitely.
mean, if you are interested in surgery, then it might not be for you. Okay, so Dr. Tishri, if you can tell us about this MRCP exam, the resources that you used for MRCP 1, MRCP 2, and then PACES.
So MRCP 1 and 2, they are a bit different from PACES. PACES is actually a very, very tricky exam.
Hmm.
So for MRCP part 1, mostly your pass medicine will be enough,
Hmm.
mostly. There are other very good resources as well if you want to like just make sure that you're passing
Hmm.
with good marks. So you can use pass test as well.
Yeah.
There's another one, BMJ on examination, so you can use that as well. I have used all of them,
Hmm.
but most my main focus was pass medicine.
Hmm. Okay.
So I did that, and after that, when I passed my MRCP part 1, I had very little time for MRCP part 2, and I used again pass medicine.
Hmm.
So that was my main resource. Although I was using other stuff as well, I was looking into pass test as well. And
Hmm.
one thing which I felt that it was really, really important for me was that I had a friend. His name is Shan. He's a very nice guy. So I had a friend who like used to practice with me a lot.
Hmm.
So, for example, we're coming back from hospital like 9 o'clock in the evening.
Hmm.
So we would still do like some MCQs together.
Okay.
And when so we have already gone through past medicine. We know the concepts of the MCQs already,
Hmm.
but there are little bit of tricky bits
Hmm.
that sometimes he would know, sometimes I would know. We would just
Hmm.
do like 50 questions, 100 questions every day, or on most days, just to
Hmm.
see like he'll tell me if I am missing something, and then if we both are missing something, we'll try to look like why the answer is this and why not this.
Hmm.
So that kind of stuff. So that really helped me in my part 1 and part 2 both. This
Okay.
this this worked like magic.
So you should have a study partner with you, to
I think
discuss
it is.
especially the difficult cases or things
And
that you don't understand. Hmm. Okay.
that's true for all three parts, to be honest.
Hmm.
Uh, and it stands true for paces. I think for paces, you definitely need a study partner.
Of
You
course.
cannot do paces without study partner. Uh, some people might be able to do it still.
Hmm.
Obviously, there's nothing 100%. But I think if you have a study partner in paces, and
Hmm.
probably multiple partners in paces, you probably will do much better. It seems like we all have done PLAB 2, isn't it?
Hmm.
PLAB 2, it's also a bit easy to pass if you have partners with
Hmm.
whom you are practicing. So paces is just you can say like it's advanced kind of PLAB 2.
Hmm.
It's kind of structured in the almost similar way, but it's much more trickier, much more
Hmm.
harder, much more difficult to pass. But
Hmm.
it's almost kind of same thing.
Hmm. Okay.
So yeah, so part 1, part 2, we have these resources
Okay.
mainly. When we come to paces,
Hmm.
again, I failed, as I told you before, I failed twice
Hmm.
before passing, and I failed horribly. I
Hmm.
had to change my ways completely to pass this exam. And I think what helped me was one thing was going to the hospital,
Hmm.
seeing patients, because when you will, especially in UK, and I think it stands true for other parts of the world as well, because PACES is quite a, what do we say, standardized exam.
Hmm.
So especially for UK and other parts, I would say as well, other places as well, they would take the patients from their own hospital mostly,
Hmm.
and most of the patients will be same as you see everywhere in UK. So practicing on your own hospital's patients is something that is, I think, it's very, very important,
Hmm.
extremely important.
Hmm.
So that's how you start to pick up the clinical signs.
Hmm.
That's how you start to notice like what will I look for? What do I need to look for?
Hmm.
Because your eyes will be blind to something that you're not even looking for.
Hmm.
So a rash might be very apparent to you from the
Hmm.
end of the bed, but subtle signs, if you're not looking for them, you'll not find them.
Hmm.
And practicing on real patients is something that will help you. So we used to go in groups, two to three people. One will time, one will do the viva, one will
Hmm.
examine, and we used to do that
Hmm.
for quite a few days. We did that, And then second thing was for long case consultations and for communications. We used to practice online
Mhm.
with friends. Like we used to have, like in real exam, you will have 15 minutes.
Okay.
What we used to do was like 13 minutes
Mhm.
because we will verbalize our exam.
Mhm.
So I had again a very good friend, Fahim. I learned a lot from him. So he and myself, like we used to do a lot of practice online, and then we had some other study partners as well.
Mhm.
So 30 minutes for long case and 9 minutes for communication. 13 minutes because we are going to verbalize our examination in real terms. It will take more time, but
Mhm.
verbalization only will take 30, 40, 50 seconds. So full history, verbalize exam, then speak to the patient, 13 minutes. So we did a lot of cases like that. We
Mhm.
tried to do the cases which were like people were saying that this is coming up in the exam and kind of stuff.
Mhm.
And I the book that I would recommend, there are actually two books which I love the most. One
Mhm.
is Cases for Paces. I can show you actually. That's the one, Cases
Yeah.
for Paces. It's actually a really nice book for paces. And
Mhm.
second, my most favorite books, one of my most favorite books is this, Rider,
Right. Okay.
Rider.
Mhm.
So these two books, and then you will have some stations which RCP has given you already.
Mhm.
So if you go just Google like RCP basis cases for practice, so you
Mhm.
will get some cases there as well.
Mhm.
So those cases you should not read them. You should practice them. Like one you read, one your partner will read,
Mhm.
and you both give it to each other. In that way,
Mhm.
what happens is because these cases are calibrated as per RCP, they
Mhm.
have calibrated them already. So when you will practice, you will know like which bits you actually missed, which RCP was actually looking for,
Mhm.
which questions you should have asked, which RCP was actually looking for, but
Mhm.
you didn't ask. So
Mhm.
you will identify your mistakes in much more easier way.
Mhm.
So I think these are the things. Plus, there are some websites, very good websites. One is called Learn Him. One is Leeds. Leeds Medical Education Department has they have created a website for themselves as well.
Mhm.
And a lot of diseases are not actually covered in these books, like Rider and this past cases for paces. There are a lot of diseases which are not covered.
Mhm.
But they come up in the exam, so you have to read them. Like you have to cover them yourself.
Mhm.
But
Okay.
I think when you will be start practicing, you'll start asking people like what kind of exam they had, their experiences and kind of stuff, and especially Rider will give you a very good idea of stuff.
Mhm.
So I think that will help a lot.
Okay.
I'm
So
not
in
asking you to just one thing. I'm not asking you to ask the exact stations which came
Mhm.
into the
Of
RCB
course.
might
Yeah.
not like it,
You
but
shouldn't.
like
Yeah.
yeah, that's not what I'm saying.
Yeah.
I meant to say like you can ask other people's exam experiences,
Mhm.
and they might be happy to tell you about that.
Okay. Yeah. That's great. So in terms of practicing the cases, I mean, practicing in terms of real patients, how long do you think it should take to prepare for this PACES exam?
So if you're working
Hmm.
in an NHS hospital,
Hmm.
it should be around 4 to 6 months. And other source that I forgot to miss, I missed, I forgot about it. That is past test videos. They are
Process
really
videos.
good. Yeah,
Okay.
past test videos are very good for paces when it comes to paces.
Hmm.
So they do miss a few things.
Hmm.
For example, sometimes driving advice will be missed, but in
Hmm.
paces they will be looking for driving advice as well. For example, in obstructive sleep apnea or something like that.
Hmm.
So so yeah, there will be some things missing, but most of the things will be covered. So you'll
Hmm.
get a very good idea of what's expected from you.
Hmm. Which part of the PACES, I mean, which section do you think IMGs mostly struggle with?
I think initially when I was not prepared well,
Hmm.
I did not prepare well when at that time. I think I struggled with everything. To be honest,
Hmm.
I did not struggle with patients interaction like the way like managing patients welfare. I did not struggle
Hmm.
with that, but everything, and I did not struggle with communication, but
Hmm.
I struggled with everything else.
Hmm.
Um, but I think a lot of people struggle with communication as well because one of my very good friends who is actually really brilliant when it comes to paces,
Hmm.
he struggled with communication a lot. So
Hmm.
it's different people, they struggle with different things. But when if you're practicing, I think things will come up and you will be able to what do we say, rectify your mistakes.
Okay. Right. So this is about people who are in the NHS, working in the NHS and preparing for the exam. What about people who are, say, they are in Pakistan preparing for this exam? How long it should take for them to prepare for PACES, and what are the resources available there in Pakistan or in India? And because there will be many loads of different academies and courses that are available, which one to choose? How should they know this one is the correct one, this one is the right option for them?
Okay, so about that, because I have not worked in Pakistan or India a lot. I
Mm-hmm.
worked in Pakistan for a little while, and I did
Mm-hmm.
not prepare for PIS at that time. But I have heard about one of the academies. I think it's called Fast Paces by Dr. Imran. I
Mm-hmm.
think it's that one, and I have heard very good things about it. One of my friends who is at the moment working as a registrar, he recently got his training.
Mm-hmm.
He's working as a registrar in, I think, neurology.
Mm-hmm.
So he told me about that one. Like, if you're going to Pakistan, join that one. If I'm not taking the word wrong, I think it's Fast Paces by Dr. Imran or something like that. It's in Lahore,
Mm-hmm.
and that is a good one. But thing is, it will again come up on how much you can practice. It will again come to that, like
Mm-hmm.
how much you can practice yourself. Again, I do not think it should be very different if you are practicing in a good learning environment and you're practicing with the right people.
Mm-hmm.
I do not think it should take more than 4 to 6 months,
Mm-hmm.
maybe an year, but that's at stretch.
Hmm. Okay. And what do you think are the biggest mistakes that people make when they are preparing for their exam, especially for PACES? Of course, the MRCP part one and part two, we are made for these type of questions, these type of exams. So we can do really well. If we study, we can ace those exams, not a problem. But when it comes to PACES or any sort of OSCE exam, then we really struggle, especially if we haven't prepared well. So, what are the biggest challenges for international medical graduates you think they face when they prepare and then when they appear for this exam?
So to be honest, I feel I'm obviously one of those. I'm one of IMGs. I'm one of those
Mhm.
people who struggled with this exam a lot.
Mhm.
I think underestimating the exam is one of the
Mhm.
biggest thing that we do,
Mhm.
because I passed almost every exam in my life, like in first attempt. I
Mhm.
did like all my MBBS exams I did in first attempt. Then like PLAB 1, PLAB 2, first attempt. MRCP
Mhm.
part 1, part 2, first attempt. And
Mhm.
then I probably underestimated this exam a lot.
Mhm.
This is a very high level exam. This is one of
Mhm.
the most prestigious exams that you will ever take when it
Mhm.
comes to the field of medicine.
Mhm.
So do not underestimate this exam. Prepare properly. So when I'm saying 4 to 6 months, I mean with the right resources, with the
Mhm.
right people, and with the right approach. If
Mhm.
your approach is not right, like mine was not right in the beginning, if your
Mhm.
approach is you're not doing practice in the with the right approach, it
Mhm.
will take you years, 2, 3, 4 years. It can take 5 years as well.
Mhm.
6 months is when you have the right people, right approach, and right guidance, right resources. Then it should take like maybe 4 to 6 months.
Mhm. Okay. And in terms of cost, how much does it cost? The
Oh,
total
it's a costly
three
exam.
parts. Mhm.
It is a costly exam. So I think your part one and part two are somewhere around 500 pounds, 450 to 500 pounds,
Each.
somewhere, yeah, each,
Mhm.
somewhere around that. And your paces is around 700 pounds. I think it's 697 pounds or something like that. So it's
Mhm.
around 700 pounds spaces. But when you're in UK,
Mhm.
so what happens is, like, when you're going for a course,
Mhm.
there are a few courses. Some of them are really good.
Mhm.
So I would recommend, if you're in UK, I would recommend Paces Ahead.
Mhm.
Second number, I would say Pass Paces is also very good.
Mhm.
So Paces Ahead and Pass Paces are almost same, almost same. I would say 99.9% same.
Mhm.
But it's just the way I felt like I felt a bit more friendlier environment, a bit more lighter mood in Paces Ahead as compared to Past Paces. But I would say they are both almost same, and they are both very good.
Mhm.
So I just slightly prioritize, like I slightly prefer paces ahead just based on my own personal experience.
Hmm.
And I've heard similar stories from other people as well. These courses are very, very expensive.
Hmm.
They're like around 1,600 pounds. And then when you go to London, they are both in London. You go to London, you stay in a hotel,
Hmm.
and for 4 days, 5 days, so it comes to like more than 2,000 pounds very easily.
Hmm.
So yeah, it does become expensive.
Okay.
And then other things, resources, past medicine is around, sorry, past test is around 300 pounds, 278 pounds, something like that. And these books are not very expensive. If you buy an original copy of Rider, I think it's around 100 pounds. Cases for
Hmm.
Paces is like 50 pounds or something like that.
Hmm.
So these are not very expensive, but like those courses are very, very expensive. Yeah.
Hmm. Okay. Right. Now, my question is especially for people who are back in Pakistan or in other countries and they aspire to become a doctor in UK or in, the developed countries. What they should do. For example, there is a doctor who has um, passed his MBBS, done his house job, and still waiting for training or waiting for some exams to be cleared so that they can move abroad. Should they go for MRCP or not?
Definitely, MRCP is something that I would say, if you are keen enough, you should go for this exam.
Hmm.
Um, if you have worked a little bit in medicine, like 1 to 2 years, I think, or if you are in training in Pakistan, for example, you're a PG trainee in medicine, year one, two, you should start reading past medicine, because even when I was a trainee in UK, to be honest, when I started preparing for my part one, MRCP
Hmm.
part one, that's when I started to look into the guidelines properly, like hypertension guidelines and other like diabetes guidelines. All of these guidelines which we follow in UK, I started reading about them a bit more in detail. That was the time
Hmm.
when I started that. So I think it will, if you're even if you're not taking the exam, if you're preparing for it, it will change your approach.
Hmm.
It will transform you into a better doctor anyways. MRCP does transform people into a better doctor anyways.
Hmm.
So if you'll start reading your past medicine, you will learn a lot of things, like
Hmm.
loads of things you're gonna learn.
Okay. And
So
how does it
everyone should.
okay, how does it add to the CV? For example, if there is a doctor who has done his PLAB or her PLAB and they are waiting for a job, applying for a job in UK and in Ireland, etc., but they're not able to get the job. If they do MRCP, what are the chances?
I think, as compared to, like, if your CV is there with an MRCP and there are other CVs which do not have MRCP, you would definitely get a very good preference.
Hmm.
You would definitely go on top. Definitely, there's no doubt about that.
Hmm.
But obviously, if it's just a part one, still it will add to the
Hmm.
value of your CV,
Hmm.
because if you're applying for the medicine jobs, and you say that a lot of jobs actually now they're saying that they need MRCP part one,
That's
or
true.
it's in their desired criteria.
Hmm.
Now it's not essential that it is in their desired criteria.
Hmm.
So and if you're going for registrar jobs,
Hmm.
a lot of jobs say that you should have MRCP part two at
Hmm.
least, but their desired criteria is a full MRCP.
Hmm.
So you will get job much easier if you have MRCP as compared to any other exams.
Hmm.
So especially for UK, I think you will get preference.
Okay. Right. I know that you also do some free sessions and also some paid sessions for this spaces. Can you tell me a little bit more about it?
So, brother, I've recently started a, what do we say, Paces Perfect. Its name
Hmm.
is Paces Perfect. So if you go on www.pacesperfect.com, you'll
Hmm.
find me there. My complete full guidance from my side, from my opinion,
Hmm.
that how you should prepare for this exam, what resources you should use.
Hmm.
So if you go on that website, and there's a place, course of action.
Hmm.
So there is full detail on that as well.
Hmm.
And my free sessions, I update about them in my WhatsApp group.
Hmm.
So if anyone wants to like get added to my WhatsApp group, they can just send me a text, and I'll be more than happy to add them.
Hmm.
So I have done around 15 free sessions till now.
Good.
Um, and I try to do them like 2 to 3 sessions per month at least.
Mhm.
And then we have recently started our Basis Perfect course as well. At the moment, to be honest, it's not an expensive course at all.
Mhm.
If you look into the competitors, my course is actually at the moment it's a very cheap course, to be honest, because
Mhm.
I'm just trying uh, to build something here,
Mhm.
and I just want good reviews first.
Of
So
course.
my course is not expensive. It's just
Mhm.
like a very small amount.
Okay.
And thing about Basis Perfect is that like the course that we do, we have very few participants,
Mhm.
so that we can look into the personal like what do we say growth,
Mhm.
person specific growth we can see, so
Yeah.
that I can have a look properly, like if this person is lacking, because
Mhm.
I myself going from a 91 marks to
Mhm.
168 out of 168, that's a very big difference. It took a lot of hard work to cover that difference, a
Mhm.
lot of prayers as well, obviously.
Yeah,
So
no, that's really a big, massive difference, and I think
yeah, it's
especially
massive
for a
difference.
person who has failed paces and then later on 100% score, that is really a massive jump. And I think it is the hard work that you have done, and you have done something right that many
Yeah,
people miss. And if you are teaching people, I think it will be a really good effort, and especially for people who are struggling for paces. I know a lot of people who are trained in UK, like they have done their IMT,
yeah.
they are struggling. I know personally know many people who are struggling with this spaces exam. So I think if someone knows more about it, especially someone like you who failed paces and then passed with flying colors, I think yes,
And I failed
it is something
horribly.
that.
I just did not just fail it. I
Hmm.
horribly failed it.
Yeah,
I
yeah.
scored only 91 marks
Hmm.
in my previous attempt, 91 over like 172 or something.
Hmm.
I failed, like I only passed 2 skills
Hmm.
and 2 or 3 skills, I think, out of 7. So basically, this is one more thing that I would want to say. What makes spaces very tricky is that it's not just a passing score that you have to achieve.
Hmm.
There are people who achieve passing score,
Hmm.
but they still fail the exam. They
Hmm.
they actually score much more than the passing score,
Hmm.
but they still fail the exam because you have to pass all 7 skills as well.
Hmm.
And in Paces Perfect, what we do is, so I'm doing only long cases and
Hmm.
consultation. My main focus is long cases and consultation because these will have more than 50% marks of the paces.
Hmm.
And long cases have they test all 7 skills in long cases.
Hmm. Hmm.
So your examinations are being tested, your patient interaction is being tested, your clinical judgment is being tested, your history taking is being tested. Like all 7 skills are being tested in
Hmm.
your long case consultation.
Hmm.
So I think this, if someone perfects their long case consultation, they can use those skills in other stations as well.
Hmm. Okay.
And then when it comes to your examination stations, it's just face to face
Hmm.
patient interaction that you have to go to hospital. No doubt about it. You have to go and see patients. That's the only way to pass your examination stations.
Okay, that's great. So I will paste all the links that you mentioned about the books and the websites that you mentioned, also your profile as well. If someone wants to contact you in
So
terms of seeking help for PACES exam, they can
thank you
contact
very
you.
much.
In summary, PACES is a real good exam. It doesn't matter where you are. If you are working in medicine or if you're planning to work in medicine, then this exam is a must for you, especially if you want to move to UK later on in your life or if you want to add something into your career. It's a good exam.
Definitely.
Thank
Anywhere you want to live, if you have MRCP, I think you will have a good thing in your hand. In
That's true.
Pakistan, it has good value. In Middle East, it has good
Hmm.
value. In UK, it has good value. In Ireland, it has good value. If you go to other countries as well, most of the countries accept basis.
Hmm.
It's a kind of a very good standard exam, and
Hmm.
I think if you are a trainee, anywhere in your training,
Hmm.
anywhere in any country, just just start doing your
Hmm.
MRCP if
That's
you
true.
can.
And even if you are not in training, in formal
Yeah.
training, I mean, it is still a great exam that you can do with your practice. Like you're working anywhere in the
Hmm.
hospital or anywhere or in your own clinic, you can do it part time. Like it's not like a full time thing that you have to dedicate all of your time to this exam. Just
Yeah.
work part time with this exam, and you can definitely pass it in about an year's time or so.
Yeah, one more thing I would just want to mention, because you have mentioned this thing, that if you're just working, sorry,
Hmm.
just reading, just
Hmm.
studying for this exam, you'll not pass.
Hmm.
So you have to be having some patient interaction if you really want to pass this exam.
Hmm. Of
So you
course.
cannot just like part one and part two, like lab and other stuff. You cannot just sit in a room, just
Hmm.
study 15 hours a day and pass the exam.
Hmm.
Paces you'll pass part one and part two,
Hmm.
but paces you'll struggle with it.
Hmm. Of course. Okay, thank you so much, Dr. Jishti. It was really a helpful session. We might need to arrange another session, especially focused on the paces, if
Exactly.
people demand it. Otherwise, thank you so much, and please send me the links that you mentioned about the books, paces for cases, cases for paces, and the other one, Rider, and also the websites that you mentioned. Okay, I'll
Sure, brother,
mention
I'll
it
send you.
in the link and your profile as well. Okay, thank you so much.
Thank you very much. Thank you, brother.